Professionals are calling it a crisis. County officials say Pennsylvania's mental health infrastructure is crumbling, and many would-be patients are still waiting for treatment. Fox 43's Marshall Keeley was there as concerned leaders took their message to the state capitol.
More problems, few programs, and growing impatience.
We routinely now hear from families who asked why it takes so long to get the needed help.
I've worked in the mental health system for more than 30 years, and I've never seen it this difficult.
This isn't a one county issue. It's not a one city issue. This is a Commonwealth issue.
Annie Strite is the mental health administrator for Cumberland and Perry counties. She says despite prevention efforts, suicide rates have doubled in her area over the last year.
We see the significant level of need, and we see the hurt in people's lives.
Berks County Commissioner Michael Rivera, president of the County Commissioners Association of Pennsylvania, says the state has neglected mental health funding for too long, putting a burden on county governments.
We're doing more services with less money, understanding that with inflation we can buy less with the money that we have.
Last year's budget broke a more than decade-long drought when it gave counties $20 million in additional mental health funding. Even with another $20 million increase proposed for this year, Strite says it won't be enough.
Cumberland and Perry counties received $352,000. This year we're projecting to have a $1.8 million deficit.
The County Commissioners Association of Pennsylvania is asking the state for a $250 million increase to jumpstart the rebuild.
Everyone is being affected by mental health, so it takes the work of the General Assembly and the administration to be able to say, you know what, we need to take this seriously, we need to put our money where our mouth is and provide the funding that we need for mental health.
Lawmakers on both sides of the aisle have expressed support for mental health funding. The state budget must be finalized by June 30th, Evan.
So, Marshall, obviously we don't know the exact numbers yet as that'll be worked out, but once the money is allocated, what's the first thing the money would address?
If the funding is approved, Strite says it should be used to help counties provide much-needed residential services. Perry and Cumberland counties, for instance, have 85 beds. They're full, and 85 more people are on wait lists right now. She says it will take a longer-term plan to address the workforce needs, though, and that starts, she says, with encouraging more people to enter the field and offering competitive wages. Evan.
All right, Marshall Keeler reporting this evening. Thank you so much.